If it's okay with Director Scott, I would ask that Anna Noves from the Department of Health join us at this time. Will that work?
That will work.
Thank you. Welcome.
Thank you. Good evening. My name is Ana Novaes. I'm the Deputy Director at the Health Department, and so it's my pleasure and honor to be here tonight on behalf of the Director. So good afternoon, maybe good evening, Chairman Conley and members of the committee. Thanks you for giving us the opportunity to speak here today on Article 20. This is an issue that our public health colleagues and at the department, we have been watching for many years. To be very candid, we at the Rhode Island Department of Health share many of the concerns that Governor Raimondo has expressed publicly about cannabis use and public health. But as the Governor has also expressed, the implications of expanded use of marijuana are now essentially unavoidable in Rhode Island, given the climate in the country, the region, and in our neighboring states. What this article represents is a proactive approach rather than a reactive one. Article 20 would create the strictest regulatory framework for any state in the country that has legalized cannabis. It incorporates several major public health strategies related to prevention, education, surveillance, regulation, laboratory testing, food protection, and treatment. A public health approach like this reduces risks and improves quality control and consumer protection. More specifically, from a public health perspective, Article 20 includes funding for ongoing monitoring and assessment of cannabis-related health effects, funding for ongoing public education campaigns about the health effects of cannabis use, the provision of referral services and treatment programs for individuals with problem cannabis use, and requirements for all consumable cannabis and hemp products to comply with RIDO food safety rules and regulations. Strict safeguards to prevent, to the greatest degree possible, youth use of cannabis and safeguards to protect other vulnerable populations, and increases the cannabis testing and licensing capacity at the state health laboratories. Increasing Rhode Island's laboratory capacity would be very important because it will enable us to regulate THC levels in cannabis. One other issue that I want to expand upon is the cannabis used by young people. When you look across the nation and other places that have moved in the direction of cannabis legalization, no state has set up a series of legal and regulatory blocks for children and youth that is as stringent as what's included in Article 20, and there are reasons for that. We have seen the ways that big tobacco has preyed upon young people, and in particular young people in certain communities, and we heard some of the concerns that were raised for some members of this committee. To prevent that from happening all over again, large portions of Article 20 are devoted to advertising and marketing restrictions. Cannabis establishments would be prohibited from using pop-up digital ads, billboard advertising, signage outside that features a cannabis leaf on neon lights, or text messaging ads, to name just a few tactics that have been used. There would be a ban on the sale of products in the shape of animals, vehicles, or any other shape that would be attractive to children, and a requirement for packaging to be opaque and difficult for children to open. Article 20 would establish strict fines and penalties for distributing cannabis to people under age 21 and prevent retailers and other establishments from operating close to schools. Cannabis smoking and vaporizing would be prohibited in public housing, public places, and in multi-unit housing complex without the written permission of a landlord. This is being done to protect children and others from the negative health effects of secondhand smoke. Before I wrap up, I did want to rely that in conversations about adult use cannabis, it is important that we distinguish it from the medical program. Rhode Island has had a medical program since 2006. It has succeeded in part because of the laboratory surveillance and healthcare provider education work that has happened at the Department of Health. The medical program currently serves more than 18,000 Rhode Islanders with chronic illness and debilitating pain, among other issues. For these individuals, cannabis is medication. Like anyone else in our state, these individuals deserve medication that is safe, and they deserve to receive it in a way that is compassionate, timely, and efficient. For patients, Article 20 would increase access to the medical cannabis by increasing the current number of compassion centers to 9. It would also increase access for patients by allowing for an income-based sliding fee scale for patient and caregiver renewal fees, licenses. Finally, it would clarify that caregivers may only receive reimbursement for actual expenses incurred and prohibit them from charging for time, knowledge, and expertise. The implementation of this adult use proposal would require a significant effort to keep Rhode Island safe, particularly those who are most vulnerable. This effort would need to be collaborative. It will need to involve public health professionals, people in public safety, parents, educators, community leaders, neighbors, business, and of course, you, members of the General Assembly. We in public health are going to continue to look up to you for your thoughtfulness and your support in the upcoming months and years. You have been a tremendous partner for the Rhode Island Department of Health in terms of promoting the well-being of people in every community in our state. And we look forward to building on this partnership with you in this new era and to working with you to ensure success of some of the critical public health safeguards that we have discussed here today. So thank you.
Thank you very much for your presentation. Any questions or comments for this witness? Senator De Palma.
Thank you, Mr. Chairman. Anna, Associate Director, thank you for being here. A question or two questions for you. You talked about the stipulations or regulations with regards to trying to restrict the secondhand smoke in dwelling units. And while it's, I think, an altruistic, lofty goal, I don't know how you place that. I don't know how you enforce that. So I think it makes us feel good that those things are in there, but at the end of the day, it's going to become something that becomes burdensome, and should this move forward, someone's going to say, take it out because we have no way to address that. So talk about the trade-off between our desires to do good and the real practicality of even doing it.
So we will be following the same provisions that we have current for secondhand tobacco smoking. You have a smoking law in our state that prohibits smoking in public places, in work, and so forth. You are very well aware, we for the 7th state, that will mirror that same kind of law and prevent for that secondhand smoking exposure. Same thing in housing. That's the goal in there, to follow the lessons learned from tobacco and apply them in this area.
So, similar question that I brought up to Norm and Director Tanner and Matt when they were there. You're in the Department of Health.
Yes.
Your goal is to ensure we have a healthy Rhode Island.
Yes.
In your opinion, the use of recreational cannabis, you support that or you don't? From a health perspective. It's a good thing from a health perspective or it's not?
We cannot say that it's a good thing from a public health perspective, which is why we have all of this framework in place to prevent the harmful
I'm
acts.
good. Thank you.
Senator Stephanie.
I can hear you.
To a, oh, there we go. There, hey, look, it turned on. I didn't touch it. Okay. So about a year ago, I went to a lecture that was that was given by a psychologist. I think he was from Colorado. The guy's name escapes me, but I can get it for you. So I don't remember his name, but I do remember his message. And it was pretty powerful that if you're smoking marijuana and you're under 25 years old, somehow your brain structure is changed by the fact that you're ingesting marijuana, however. Have you heard of this?
I think there's many research out there, and there's many more things to be learned. Our brains are exposed to many substances and to many experiences that do alter the development of the brain.
I've explored some of
marijuana-
those, but I'm interested in...
Marijuana is no different from other ones. Same way if you drink alcohol, if you do many things that are allowed and are legal. I think the issue is more about what are the framework that we put in place from a regulatory perspective that helps us control what we are responding to, that helps us provide the right message in terms of education to adults, to parents, to teachers, to youth. So whatever we have in place creates a safety net to what we are responding to. That is not a way that it's in here, in our state, it's in our world. And I know that the question was asked, do we agree that is a good thing? There is no such a good thing or a bad thing, but it's a thing that is here, and the good thing is how you respond to it.
Well, I guess I want to narrow down on Senator De Palma's question. Is it a good thing for a young person to be doing? Under
If it's a good thing
under
for-
25 years old, where, I mean, I was told that brain function and brain development is still taking place, you know, up until you get into your mid-20s.
Your brain keeps developing sometimes we would say even beyond that.
Okay.
But the most impactful time of brain development is in fact during the first 3 years of age, the first 1,000 days of life for an individual. But the brain continues to develop. But I don't know about that specific research, but I can definitely look back into it and let you know if we find anything from that.
would
But we agree with the age of 21.
I would really like you to do that, and I'll get you the fellow's name. Would you recommend someone under 25
We
using
agree with the
marijuana?
age of 21 that's being proposed in this regulation.
Oh, yeah,
yes.
I know what's been proposed. That's just the age of legal majority. I don't know what that means in terms of the physiology of a person and whether or not they should be doing this.
As a Department of Public Health, we are agreeing with the age of 21. And let me also clarify, I'm not a physician, I'm a psychologist. So if I'm not responding to some of your questions, I cannot respond from a clinical perspective, but from that perspective, as a health department deputy director.
Okay, thanks.
Thank you, Senator. Senator De Palma?
Thank you, Mr. Thank you. Director, let me rephrase the question a different way.
Yes.
So the consumption of cannabis is positive, yes or no?
I cannot say that, sir.
So then there's not a, so when Norm, the directors were talking about the negative public health benefit,
Yeah.
you would say that doesn't exist because...
Oh, absolutely. There are negative impacts of public health in the consumption to young people,
Okay.
to our
So there's not,
pregnant women and all of those others.
there's not a positive benefit then?
No, there's no positive effect from that perspective.
you.
Absolutely. I agree.
So I guess with Senator Seveni's permission, I actually want to go back to a suggestion, a series of questions and a suggestion that he had. And I think this is a really good question from the position that the perspective that you bring as a psychologist and the clinical part of this. What's your reaction to Senator Seveni's suggestion that we allocate more of the revenue from this initiative to substance abuse and prevention and education?
So I think the way we are distributing the revenue right now, it's appropriate in terms of building up the infrastructure. We believe that as we learn more and as we see what's the impact because we need to start studying, and we look forward to do that, monitoring and surveillance and prevention. As we continue to monitor, there is an agreement among the government that if, among state agencies and all working together, that if needed be, more resources would be allocated, and we'll be coming back to you to have that conversation. But we believe that what we have right now in front of us, it's enough to start building the infrastructure that we need to study. But absolutely, resources are always welcome, dedicated to prevention and to treatment and to educational campaigns.
And I guess with Senator Sosnowski's permission, I'd like to present one of her earlier questions as well. In all candor, it's not something that I thought of until Senator Sosnowski brought it up. But when you think about the cultivation of what we're talking about here, really hadn't thought about the fertilizers, the sprays, the growing media, and the expertise on all of those and how they impact public health are really over in the Division of Agriculture. What's your reaction from a public health perspective of bringing in that expertise into the regulatory and inspection regimen for this initiative?
I think we work very closely with the Department of DEM, and so absolutely I don't see that as being an issue. But we are not doing inspection in terms of production. That is really not under us. We're doing from the food safety perspective, assuring safety, and that we will do it, continue to do. But I do agree that that is and we worked with the division very closely.
Thank you. And if I didn't paraphrase any of your suggestions properly, please correct me. No, thank you. Thank you. Any other questions or comments from committee members?